Well, greetings and welcome to another edition of Coffee with Cade. I am your special guest host today. My name is Kristen Young. I am the communications coordinator with the Cade Foundation. I'm excited and honored to have this opportunity to be a host of Coffee with Cade and to share some information with you. We have a special guest, and we are talking about fertility abroad. And what does that look like? This is a topic that is relatively new for me, so I'm excited to hear more and learn more about that, especially in just kind of the situation we're in. Obviously, we are in still knee deep, probably neck deep
Neck deep.
neck deep in coronavirus. But hopefully you have your mask on so it won't go above the neck. But yeah, so we are clearly in the midst of very, very different times. So we're going to talk about that and more. So I'm excited to have our special guest, Dr. Joseph Doyle from Shady Fertility, here to talk about fertility in general, but definitely around the topic of fertility abroad and what that looks like. So welcome, Dr. Doyle.
Well, thank you, Kristen. I feel special that I'm the special guest with a special host. I think we're a special combination today.
This is special. This is the first time situation, and as we were sharing earlier, these are just, there's no normalcy anymore.
No, exactly. It's just adapt. I think it applies to the what we're talking about and everywhere.
Absolutely.
You and I are at home right now doing this, so yeah, it's just swing with the new reality, right?
Roll with the punches, go with the flow. That's just where we are. That's where we are.
Kind of thinking a little bit about what we're talking about today with seeking care internationally. I happen to work closely with Bob Stillman's was one of the founding physicians of the practice, and I worked really closely with him, taking care of couples that we work closely in Canada. And so Dr. Stillman and I spent a lot of time working with Canadian clinics and couples, and so we have a ton of experience. So I can definitely give a version of my sort of appreciation from it, strongly influenced by my experience there. But that is like sort of a little lens I could add to whatever we are getting into today.
Awesome. So I'm excited for this. For those of you who are watching, if you have questions, please feel free to post your questions in the comment section, and we will make sure we get answers for you in relation to anything that you have to share. Or anything additional that you want to know about this particular topic. So, and also we encourage you to share this video. We encourage you to share this information. It's
two special guests.
Okay? Two special guests.
The
price of one.
That's amazing. Right?
Yeah, share this video. Share this video. Okay, this is important information. This is a conversation, not a presentation. So it's very, very relaxed, but very informative nonetheless. So, Dr. Doyle, so you mentioned that you worked closely with Dr. Stillman, and that you all were connected with. You have colleagues in Canada that you've been working with. So tell me a little bit about why are people leaving the country to seek fertility treatment? Is there a difference in the treatment itself, or what's going on there?
Yeah, so specifically what we were working with Canadian practices with is primarily related to egg donation. And that's one of the reasons that people travel. There's just regulatory differences from country to country. And honestly, in our view, Canadian folks would be best served by being able to do that treatment there. But there's a lot of regulation that makes it really, really difficult about the availability of donors and things that make it tough for couples who are trying to proceed. So if there's a big restriction on the availability, then that's where, people oftentimes look abroad. And you see this, Canada happens to share a border with us, and so they can, in the U.S., this is the U.S. the FDA is heavily involved in the process, but the ability to have a bigger pool of donors to select from is obviously a very appealing characteristic if someone needs to pursue that, because it's a very big decision, and if you don't have any choice, or it's a very long wait, 6-12 months before anything may happen, that's kind of tough for people planning for a family. So we've worked very closely with Canadian clinics primarily on that front. And you see kind of a similar setup in Europe too. There's a lot of the regulatory framework over there, specifically related to egg donation, is like country to country. And those countries are so close together that where it might be much easier in Spain or parts of Eastern Europe, you might not be able to access egg donation, for instance, in like Germany or Italy. So you see a lot of cross-border movement there.
Got it. Okay. So,
but regulatory, you were saying, like, what are the different, regulatory is one, and that's like, I guess, primarily where we work closely with the Canadian clinics that we work together with and the patients there.
Okay.
But there are other reasons. I mean, people also, the U.S. Is generally the forefront when it comes to sort of the availability of testing, like being able to screen for autosomal recessive disorders. In some places, people come to us from other countries because they and their partner carry, whatever, or they've had an affected child with cystic fibrosis or sickle cell disease or spinal muscular atrophy. And you don't have the ability in all countries to be able to do the testing where you can identify which embryos are affected and which are not. That's just not available in every country. That is something possible in the US. And so for some people specifically come to treatment for here. The realistic downside about care in the US are considerations about access. I mean, it is, the insurance coverage is very spotty and variable across a huge country. And so whereas, there are places, there are states where there's a mandate in place, and that might help a big portion of people access care. But then there's still a lot of people paying for this out of pocket. Compare that to Europe. Their utilization of fertility treatments, specifically, let's use IVF as one that most people have heard of. In the States, it's just over 2% of the population, of the total population, has used IVF for any reason under the sun. It might be all sorts of reasons. But if you look at that, in Europe in general is north of 4%. And you look at sort of some of the Scandinavian countries, it's as high as 10%. 10% of babies, or 10% of the population has done IVF. Now, in those countries, generally fertility services are covered as part of health insurance. Whereas if you get into the States and you don't have any insurance coverage and you're paying for this all out of pocket, it can be a real hurdle for people.
It is.
Yeah, and so people will travel for that. Having a family is incredibly important. I think it's something that it's our responsibility as, providers in this field to make sure that we're making progress in the direction that will make, care more accessible. But there are parts of the country parts of the world where, Latin America and Mexico, I've had patients go there just because they say treatment costs are a lot less. So there's just practical considerations like that.
Wow.
Yeah.
And that's and you're right. And that's, for those of you who may not be aware, that's exactly what one of the benefits of the Cade Foundation, our support. And our focus is supporting families overcoming infertility. So for those who are in that place where they're saying, I need to seek other options for family building, we offer those grants up to $10,000 for that support, because it's very expensive, and everybody's situation is different. Some people are in a position to borrow, and some are not.
And yes, it is. It's amazing that we have like organizations as wonderful as Cade in this world, but thank goodness for you. But I think you and I both know that we can never quite reach all the people we want to, and
right.
I think it's sort of the onus is on us to continue to improve to make that better. Because if it's 2% of the population is able to access this, then we need to work on that. So
absolutely.
Part of being young field is you need to grow. We need to grow. We need to make this for more people.
Okay, absolutely. So let me ask you: are there any like major standout pros and cons to making that choice to travel abroad for treatment?
Yeah, I mean, so
Outside of the cost.
Yeah, this thing about IVF, just because that's like the most common thing. Egg donation is like a relatively small little niche. But the majority of people who are doing fertility treatments are thinking about IVF because many of the simpler treatments are more doable. It's when you get into the kind of the higher tier stuff, that's where it can become a little more relevant. So there's just some like kind of structural considerations around it, Kristen. And I mean, very practical question that anyone would want to be thinking about is, if an IVF cycle, it usually from the time it usually starts at the beginning of a cycle, the stimulation part of things where you stimulate the ovaries to give us that bigger number of eggs, that usually lasts about 2 weeks, and you need to do some amount of monitoring in there. Now, I've definitely seen people where they start the cycle here and they do monitoring for several visits. And then once they get towards the tail end of their cycle, where they're getting close to the time where they'll do the retrieval, then they would travel wherever they're going. So that they could kind of, because if it's a 2-week stimulation, do an egg retrieval, and then do a transfer between day 3 and day 5, 3 to 5 days later. Not all of us can just sort of disappear and go stay somewhere else. And,
right.
You need to make travel plans and it can be kind of like a little logistically fraught. Now, if you have a lot of flexibility, that can be manageable, but it's not super easy to just sort of like have a ton of flexibility for a process that if you look at the whole thing from beginning of stem to the time you're doing a transfer, that's about 3 weeks. Yeah, you can go back home for the beta. That's super simple. But 3 weeks is a little chunk of time. And so we have really good outcome data that's pretty easy to interpret. Depending on where else you go, I think an important question that anyone would want to be considering is, I just would want to see what the data looks like, because it's not worth your while to go spend 3 weeks somewhere if they don't do a great job on a cohort that's similar to you.
Got it. Okay.
A layer, I guess, that would be a little more complicated. You really want some input on this is if you get into using a gestational carrier internationally.
Got it.
That's super nuanced. When you think about making sure that's lined up ahead of time, and that is really specialized legal advice that you want to get on that front.
I apologize for that.
No. I don't think they want Kristen and my legal advice on if I have a gestational carrier delivering a baby in India. I don't think you want us. You need the pros for that. So that would be an area where it'd be a little bit more convoluted, but yeah.
Awesome. Okay, well, Dr. Doyle, this has been excellent information, and hopefully for all of you viewers, this has shed some light for you, and maybe there's some more information. Maybe this is something that you may want to consider. It's always interesting to learn what's out there. I mean, in any journey we're taking in life, whether it's education, whether it's growing your families, whether it's your career, it's always great to just kind of see what else is out there and to learn more.